Then and we're live.
Okay, now we're they missed that whole little song. That's too bad.
Sorry, guys. Sorry.
Okay, let's make
Tune
sure
in
that
later.
it's coming up on.
Hello, everyone, and welcome. Thank you guys so much for joining us here on this beautiful Sunday, very
Sunday,
special Sunday.
Jay and I have been so excited about this day for almost a month now.
We have like butterflies going on.
Yeah, we do. We are so excited. So I just want to give everyone a little warning. Prepare yourself to
fall in love.
Completely. Prepare yourself to be informed and prepare yourself to feel more empowered. We are so grateful to be joined today by the natural pet doctor, Dr. Katie. Thank you so much for spending part of your Sunday with us.
Oh, you two are amazing. So I appreciate you having me and all you do for cats and cat lovers across the world. So I am very honored to be a guest here with you guys. So I appreciate it.
Oh my God, honored is a big word.
I know.
You're all about the sweet word today.
Guys, you are going to seriously fall in love with this amazing, beautiful veterinarian who isn't new to the picture, but you guys might not know her just yet. She is the natural pet doctor, and you guys know that we are all about helping our cats naturally. So we are really excited to be able to be joined by Dr. Katie today. Can you give everybody, anyone that doesn't know who you are, a little intro of your amazingness?
Of course. So as you already mentioned, I'm Dr. Katie Woodley. My business is the Natural Pet Doctor. And, I've been on this holistic journey since 2013 when my husband developed an autoimmune disease. And I realized conventional medicine was very limited. And then that's also when I realized I wasn't doing my patients a huge favor, either telling them there's nothing more you can do. So there may be a lot of pet parents that are listening and cat lovers that are hearing those exact words from their veterinarian. And I'm here to tell you there's other ways. The path's not always easy, but that's where creating the Natural Pet Doctor, I've been able to transform patients' lives through nutrition, Chinese herbal medicine, acupuncture. And we do a lot of education too, because there are not enough holistic practitioners out there. So we do a lot of telehealth. We also have a lot of education on the Natural Pet Doctor. We do a lot of social media too. We have a YouTube channel. So if you're looking for more information and advice, make sure you check it out. And I'm just so grateful to be here because I love sharing and educating, as both of you beautiful ladies already know. So thank you once again for having me.
Your passion is truly inspiring. And I think one of the things that's so valuable about what you do, and you're really doing this on your own, the resources that you offer all of us are it's really mind blowing. I mean, you have a great website, but your social media channels are also full of fantastic videos, webinars. You've got a group to tell people a little bit about. I just love how accessible you are and how much you offer, just as far as looking stuff up, like your video on YouTube about heading to the vet with your cat. I mean, it's fantastic. Tell people a little bit about where they can find you and all that kind of stuff.
Okay, perfect.
But
yeah, so of course my website's thenaturalpetdoctor.com. Everything is The Natural Pet Doctor. So if you look that up, you'll find me. The YouTube videos, we release new videos every single week on different topics. So dogs, cats, try to cover the cats too, because there's not enough information about cats. So that's Dr. Katie Woodley, the Natural Pet Doctor. And you can, of course, search. And one of the videos that I love in there is the herb garden for cats too, like creating your own herb garden. So as we know, being a cat parent, that it can be really difficult to medicate cats sometimes. So I love the talk that I did with the amazing Julianne over in the UK. So make sure you check that one out because that's really helpful. But also we do blog posts every single week. And then of course, social media. Every single day we're showing up there and we're doing a lot of live videos. We also have a free Facebook community called the Natural Pet Parent Community that you can join in, and we do a weekly Q&A every Wednesday with that community where you can submit your questions. You get me answering them as a veterinarian with a holistic approach. And then every Friday we do a coffee talk with the doc, and that's on our Facebook page and also the Instagram page. And we cover different topics in pet health from a holistic approach. So that's always 7 a.m. Mountain Standard Time every single Friday. So make sure you subscribe and just follow along because there's a lot of different content. And I, of course, love hearing from other pet parents on the topics that are most important, because if we've already done it, I can share the resource, and otherwise we can update and create new resources for you.
Oh my gosh. Do you drink caffeine?
Yes.
Seriously.
And maybe some wine too to help
See,
me
I told
sleep.
you would love her.
You got a little IV drip just off camera that we can't see, right? Caffeine, and then at 5 o'clock it switches over to wine. I love
Yeah.
we've got a bunch of people joining. I love it so much. And I think
Yes.
one of the challenges, especially we have as cat parents, is this reluctance to go to the vet. And so many questions that we get are, I do have to go in for a wellness exam. I've got to get, or they think that there might be something wrong with their cat, and they're afraid to go in, especially if they feed a different kind of diet, or if they're worried about over vaccination. And I wanted your perspective
I'm
on,
going to try not to use that word too much.
oh, sorry, the V word.
We'll just say the V word.
But your perspective as a veterinarian, and you were conventionally trained over in New Zealand, which is beautiful. But this holistic integrative approach, the different modalities that you're now incorporating into your practice, from your perspective, realizing that many of us don't have the option of having a relationship with a veterinarian like you personally, how can we best foster an honest and communicative relationship with our conventional veterinarians?
Yeah, how can we find it? We can't find you guys, we are always talking about ahvma.org and how you can find a holistic vet near you, but a lot of times it's, people are 3-5 hours away from a good veterinarian that they feel like they would most mesh with. And then other people don't necessarily know if I should go see a holistic vet or if I should see a conventional vet, or what's the difference? What does it matter? I just don't want to go because I don't want to be forced to do something with my cat. So, what are your thoughts on like you just asked?
That was like 15 questions. Pick us.
It's okay. I think I got them all. So
Okay.
let's start with like conventional versus holistic. What is that definition? Because some people may not be familiar with that. And so here's the thing. I call myself a holistic veterinarian. Integrative would probably be a better word for it. I'm not against conventional. There's a time and a place for the V word. There's a time and a place for the antibiotics, so there's things that if your cat has a urinary tract infection, yes, we need to work it up and find the root cause, but I'm not, and culture it and use the right antibiotics. So there's a time and a place. Now, the difference is that I've gone on and done a lot more training from the conventional side. So I've learned all the things, and then I wanted to go deeper. And we also look at the pet differently. So we're looking at the pet as a whole, how everything's interconnected. And so that's where, rather than seeing a symptom like a urinary tract infection, I'm asking, well, why did that happen? What is the environment? What is happening in that environment? What is the diet? What do we need to address so that symptom goes away and we fix the root cause? So that's a huge difference. And that's been a game changer for transitioning over to a more integrative role. Now, like I said at the beginning, there's not enough of us out there. So this is where what I recommend for every single pet parent, you need to have a partnership with your vet. You may not meet eye to eye on every single topic, but what you can do is you can interview them. You can call up the clinic and you can also ask, is there a person in this practice that has a special interest in feline medicine? So like, even if they're not a feline specialist, a cat specialist, they could be a huge cat lover. The cats love them. They love their energy. They handle them differently. They're more likely to talk about behavior versus just talking about like, oh, you're due for this, and that's it. And you get nothing else, which doesn't sit with us from a more holistic approach. And you also, what can happen too is when you do that, and if you can't find that, find the person that you feel the most comfortable with. And then if you need additional advice, that's where you can partner separately with a holistic vet, and you can do telehealth. So that's where I work with a lot of people across actually the world, because they may not have the access close by, but I partner with their conventional vet. So that way they can get the blood work, they can get the exam, which is so important at picking up these diseases before they become a problem. So I would say find the person that you feel the most comfortable with, knowing that, okay, they may not understand raw feeding. They may not understand that kibble isn't necessarily the best diet for cats, because that's what we're taught in vet school. So, that's unfortunately what you're coming up against. But I would say, the best thing is find someone at least that's open they're not condescending, they're not rude to you. If they are, find another veterinarian. There's a lot of conventional vets out there. So that's the thing, never just stick with someone. And personal side note, when my husband first got sick with his autoimmune disease, I've seen so many different gastroenterologists with him, and there were doctors where I knew we weren't a good fit because of the way they talked to us and the way they treated us. And I sat with it, let it be. And we moved on and we found a different gastroenterologist. So it's okay to get a second opinion. It's okay to move to a different veterinarian if you can, or even to change veterinarians in the same practice, because you are the advocate for your pet and you need to feel comfortable as you can going to that practice, because every cat still needs to be seen. They need to be examined. They need to have blood work done, because as we know, cats are so good at hiding disease. So that's really, really important. But I would say, don't be afraid to ask the questions and see, maybe there's a technician that's like awesome with the cats and is just like, loves cats and has all the cats. And so book your appointment with her when she's working, and then see if there's a veterinarian that has a better or more of an interest in feline medicine. And that can make the world of a difference in a conventional practice.
Yeah, I agree. Absolutely. And did you know, actually, I just got an email, I think yesterday or the day before, that today is National Take Your Cat to the Vet Day. We did not know that.
I know, I realized that too. I was like, this is perfect.
I was like, oh, wow. Okay. This is meant to be. That's pretty cool. But that, when it comes to this whole subject, I think that the one thing, actually, the statistics show that dogs are taken routinely to the vet for a wellness exam, checkups, things like that, to be more proactive. Whereas cat parents, for the most part, are not doing their wellness exams. What do you think about how should we go about that when it comes to our cats?
Being more proactive than reactive.
Yeah, that's a great point. And I can feel it in myself being a cat parent. Like, I'm like, I hate taking my cat to the vet. I'm not going to lie. Like, honestly, like, the less I have to go, that's great. But the thing is what it comes down to a lot of the times is the stress. Like, think about your cat, right? They're sitting there, they're sleeping in their spot in the sun, and they're just like, this is fantastic. And then you bring this box out and you shove them in a box, and then you put them in another box, the car, right? And it's like moving, and they're like, what the heck? The world is ending. And then you move them into another box, the vet clinic, that smells like dogs, smells like cats. They can smell all the stress pheromones. And then they're poked, they're prodded, and they're just like freaking out. Even if they're not showing it, if they're not used to that, there's still stress response, and we're stressed. And so we hate that feeling. And I think what we can do is we can be more proactive with reducing the stress in the house prior to those appointments. And that's where, like, if you can, leave the carrier out. I know you ladies have that amazing cat carrier that doubles as a bed. So it just stays out all the time. And you can put treats in there. You can put food in there. You can use pheromones to help calm them. So that way it becomes less of a struggle, less of a scary thing. You're less like stressed too. And your cat also is getting like used to being put into something that's like a normal part of their environment. So I think that's the big part of it. And the other thing too is, if you are stressed, or your cat turns into a tiger, like a feral tiger at the vet clinic. Like, I see this all the time with my clients. They're like, I can't take him in. He's going to start attacking. He urinates, he defecates. Like, it's awful. Call the vet clinic and ask them if they have other options. I'm always down for doing the natural remedies first, but there are things like gabapentin that can be used also that you can put in their food. And a lot of veterinarians will prescribe that, because we know that it's so important for these animals to get seen and to be taken to the vet. So there's ways that we can work with cat parents and reduce the stress, so that way you can get your cat to the clinic. But I think the stress is the biggest thing, and it's the biggest inhibitor of getting cats to the vet clinic.
Yeah. And I think, we talk about, although we're not good about this with all of our cats, but we talk about how it also really helps with the cats that we do. It really helps if we take them out for rides, just short rides around the block, we get them used to that carrier and the car, and then they come home and they're rewarded. So every time they get into that carrier, or zipped up into that carrier, or get into that box of the car, they're not always going to be poked and prodded, and it's not always going to end in a bad situation. That usually helps the car ride. at least on the way to the vet.
And I liked your, you got that great video on YouTube. I really liked how you addressed our stress. At our Pooh Bear is this way. He's one of those cats that we don't necessarily take practice rides with because he also has an autoimmune disease that is triggered by stress. So it's like the less we do it, the better. Of course, we try to prepare before a visit. But you mentioned something I thought was important. You said, yes, play some calming music. That's a game changer. But also, let's try not to react to the meowing, the yelling. That's hard for me because I feel like I'm like, Pooh Bear, no. But it is that kind of participating in the stress, which is a tip that I'm taking to the clinic next time we have to go with him, because it's not reacting to him. It's just letting him kind of just calm down a bit too, which I think is another great tip. But that preparation, I think, is huge. And then when we do get to the clinic, I think when you were talking a moment ago just about fostering that relationship with the vet, as far as finding out where we're going to go to begin with, the link is in the description to this. So many times we're asked, I have to go, what do I even ask my vet? How I don't even know where to start. Like, I'm going for this issue, but you also want to knock out as much as you can while you're there.
Yes.
So you've created this awesome downloadable PDF.
I mean, how amazing. This is something that when we talked prior to this, I was like, maybe we should even come up with a checklist. You're like, I already got it.
I know. It's like, how have we survived this long without knowing?
I know, right? And how amazing, though, that she's already created, and the link is in the description here, that Dr. Katie has already created a checklist of questions that you can ask your vet, and that when you look at, you'll be like, oh, you know what? I've never actually asked that question. That's a good question to ask. And these questions, and especially the way you word them, I feel like it really, just asking the questions can really help foster that relationship, because from like the vet's perspective, they're like, oh, they're asking me questions. They would like to know, my expertise.
They're participating.
They're participating, instead of being like, this is what I do, and this is what I do, and if you don't like it, then screw you.
Yeah.
Doing me.
Language.
I said screw.
Could have been worse. But I think, that's such a big part of it, is like, because I've been on the flip side of that, and you can feel it. And, you get to a place where you can diffuse that, because, most of the time there's stress involved, there's anxiety, there's worry, they're worried about their sick pet. But I think when we come to the table from both sides, right, this is the cat parents, this is the veterinarians, and we like release some of that tension, like talking about raw food doesn't need to be like a tense conversation. And it's insane how many people get so riled up about it. And I'm like, let's just have a conversation and talk about, okay, for this individual pet, maybe this is the best diet for them. Let's talk about it. What's going on? What's their health like? Do they like raw food? How can we even transition them? There's so many different things about that. And also, well, what evidence or what studies do we have? Like, I love having information. Can you please send some of that to me? I'd love to learn more, right? So even if you're like, screw that, I'm not feeding kibble, right? You can still say, I'd love to learn more about why you feel like kibble's the best diet for my cat. Can you please send me some studies so that I can learn more about what's best for my cat? So that way you're diffusing a situation where, like, yes, you're probably not going to put your cat back on kibble if you're feeding raw, but you're still fostering that relationship with your veterinarian, and you're not just putting up a wall. They're going to put up a wall and everyone's just going to be stressed out. Your cat's going to be more stressed because they're going to feel that too. And so that visit is just like, you're like, screw it. I'm not going back to the vet. We're done. You don't want that. So I think the way we word the questions just to engage and learn more is so powerful, especially right now, right? Let's open our minds a little bit and just see if we can get more info.
Yes. Yeah. I think that, bridging that gap between veterinarians and especially holistic minded pet parents and veterinarians is so important, because we need them and we need them regardless. Yeah. And they need us too. Like, we need this relationship.
It needs to be a real relationship. And I think that exactly like you said, and we have done this, Jay more than me,
11 times,
where you go in and it's like, oh, that was unpleasant. Not only is it stressful and who likes to go to the vet, especially from the cat's perspective.
Yeah, who likes to go to the doctor? Like nobody.
But the casualty in that kind of attitude and that kind of conflict and not doing what we can to diffuse it, the casualties are our cats, because then we do wait. We don't do the annual wellness exams. We don't do the dentals. We don't do the blood work. And then so often, and we've been here and done this, and that's part of the reason we're here, is because we've learned from a lot of mistakes, is that we go when something is terribly wrong. And not only then are we going to heightened stress, we've got heightened stress, the vet doesn't have any idea of the health history of this pet. And it's a very difficult situation to be in.
Yeah, on both sides, right?
Yeah. And I mean, the thing is too, is when we wait, so what essentially, and this is where I love like the preventative care side, is let's talk about the tools to like support the foundations of health. And then that way you're solidifying that, you're less likely to get sick. But what happens is when we wait for symptoms to occur, it's like we're inching towards this cliff. And then all of a sudden now it's so like we've actually fallen off the cliff. That's why we're seeing disease. And now for us to fix it, you have to climb back up a cliff. Whereas before you could have just taken a couple steps back and you haven't fallen off the cliff. And I think that is so important to realize. Like, I love when there's not a name of a disease, because I'm like, those are all symptoms. They're all interconnected. It hasn't gotten to a place where we can identify a disease. And so then you can go to, like, for me, Chinese medicine. Where are these imbalances? How can we use herbs? What food therapy can we use to support that body? So that's where waiting, not ideal, becomes more expensive, more stressful, and so much harder to fix, or even impossible to fix. So if we have something like cancer developing, yes, we can do a lot of different things to support quality of life, but we may not be able to reverse it and have that pet go into remission if it's too severe. So I think that's very important for cat parents to keep in the back of their mind. And that's the power of these annual wellness visits, or even going like, heaven forbid, twice a year for your senior cats, because they age so much faster than we do. So we can pick up disease, we can track trends, and then you can integrate in these holistic modalities to reverse disease and optimize health.
Yeah. And I think it's really, really even more important for our cats that we do this because of how stoic they are, right? Like dogs, like they stub their toe, they tell you, I mean, not every dog, I'm sure they mask some pain too, but for the most part, when your dogs, they're more expressive than cats. Cats can mask something like, say, kidney disease for a really long time. And we have so many customers that come to us and they're like, had no idea, went to the vet and my cat started stopped or was drinking too much water or stopped eating or got really sick, and they're in end stages kidney disease. And it's like, these annual visits are so important, because especially kidney disease and diabetes and all of the hyperthyroidism, these things that are so prevalent, unfortunately, in our kitties, they're all usually masked until it's really bad. And if we can catch it, like you said, if we can catch it with an annual blood panel, right, then that's really important. I want to address, we didn't write this down, but I want to address this because I know this is kind of on the list, or it is on the list, but a lot of times when it comes to these annual vet visits, we always preach, make sure that we're doing this every year, twice a year for our senior kitties, get their blood panels. But then they go to their veterinarian. They're like, well, I did my annual vet visit, but my veterinarian said it's due for, our cats are due for the V word, or now I have to, they want them on a prescription diet. This is all stuff that I didn't think about before. What should I do now? I was just in for my, vet visit, annual wellness check, and now all of this other stuff is coming up. What do you say about that?
Yeah, it's a great question. And the biggest thing is, I hate the word like the V word or due. It's like your immune system just stopped working. It makes no sense, essentially. That's not how it works. They don't just run out of antibodies and all of a sudden memory cells don't work. That's not how the immune system works. But the thing is we're not taught about the V titers. So in vet school. So that's really important to know. And it's also, this is where you can empower yourself with this knowledge about learning about what titers are available for my cats. So I can tell you right now, the FVRCP, so your panleukopenia, is one of the core ones that you should be getting every 3 years for your cat. That's just the recommendations from the AVMA for our vaccine recommendations. And so you can actually run a titer. What a titer is a blood sample where you're looking at the amount of antibodies in the body. Those are the things that if a cat comes into contact with that virus, they'll mount an immune response, most likely, not 100, you can't say 100%, but most likely they'll mount an immune response, they'll clear the virus and they won't get sick, or it'll be minimum sick, like illness. And so by doing those titers and it comes back positive, you can say, my cat does not need this vaccine this year. So when you're already drawing blood for the annual CBC, biochemistry, thyroid check, SDMA is checking for kidneys, make sure that's on there. Pro BNP checks for heart disease, which cats can mask until it's too late. Those are all things we should be checking each year. And we should also be doing that titer when they come due. Now, rabies is a different one. So rabies is due, it depends on which vaccine they're using. It'll be due each year, or it'll be every 3 years. But this is where it's a public health thing. So it's required by law. If your cat is sick or there's something else going on with them, in the V label, it actually says you cannot give that to them if they're sick. They have to be healthy. If your cat's drinking excess water, there's a behavior change. They have a UTI, they're over grooming, they're excessively, like they're losing fur, they're losing weight. Your cat is not healthy and should be not being vaccinated. That is so important. And so many veterinarians don't follow that, which breaks my heart because there's something going on and we probably just made it worse by giving that. So having that conversation with your veterinarian is very important. Like, hey, can we check a titer? Let's check a titer first and do the blood work and figure out what's going on. And then if they come back and they're healthy and we get them better, then let's look at like giving them those vaccines, right? So that's what you can say to them to help diffuse that situation. And most veterinarians will be fine with that, because then you're partnering with them to figure out what's wrong with this cat and how can we fix it. And you're not saying, no, I don't believe in, doing that. And I don't want to do that. Why are you recommending that? And so it actually diffuses that situation too. And you're also kind of, I don't know if power is the right word, but you're giving the power kind of like back to them, where you're like, okay, now they feel okay. They're putting their guard down. They know that you want to work with them and it's all okay. And you're in it for the best care for the cat. It's not just, it's becoming this debate over, we're anti-V and all the things like that's being thrown around right now. No, we actually want to make sure that the immune system's okay. So I think that's very, very, very important. A couple resources to learn more about titers would be going to hemopet.org. and also protectthepets.com. And what I love about those is that you have the information. And so you can bring it, print it off. It actually tells you how your veterinarian can take a titer, where to send it. So if you're getting quoted $500 for a titer, because I know that happens. I've worked in clinics where I was like, this isn't what we're paying. Like, this isn't even a normal markup. There's going to be markups, it's just business. But like $500, give me a break. To run a titer is $50. And so you can actually go on those websites and it'll tell you what samples that the veterinarian needs to take, how to package it, where to pay for it. And essentially you're paying for the blood draw and the shipping fee, and you can take care of it yourself. So that way, if you're getting a no, we don't do that, we don't offer that, it's going to be $3,000 for you to check this. Why don't you just give it? It's cheaper. Say, nope, just a second. Here's this information. You've already printed it out prior, so it's with you, and you can hand it over to your vet and say, I prefer to do this first. Let's go down this path, and then we can reassess. And that way you've got all the tools, you're talking to them like they still matter, but you're advocating for the best care for your cat. So I think that's really, really, really important.
And am I correct that veterinarians are titer tested?
So I'm not, because there's no rabies in New Zealand. So I never had to get the vaccine. But here's the thing with the rabies vaccine though. So if you go to vet school in the United States, I believe you have to have the rabies vaccine. And then what they do is you can get the titer to make sure that you're still safe for it. And that titers, they're actually a different level for protection. They're 0.1 international units per liter, whereas for travel, so like for international health certificates, very strict, right? Especially if you're going from here where we have rabies over to a non-rabies country or just anywhere where you have rabies, it's 0.5. But if you're doing a rabies titer, you can actually do that titer to showcase that my cat actually has protection, and you go by the 0.1. And that shows like, oh, if they came into contact with like a bat or a rabid raccoon or some wildlife or something happened, they're protected. So you're less likely, if they're not vaccinated, on a public health level for some crazy stuff to happen where they take your pet and they euthanize them because of that risk. And that can happen. That's the downside with the rabies and the seriousness of it. I've seen it in practice where a kitten, they took it in and it was rabid, and none of the animals, they had, I think 3 animals. I think they had 2 dogs and another cat. None of them were vaccinated. They euthanized every single one of them to test for rabies. Like hands down, no questions asked, because there was no vaccine status. And it, like, I get goosebumps thinking about that, because they thought they were taking in this kitten to like help it and rescue it. And then the entire fur family was put down. So this is why messing around with rabies, like get the initial vaccination when your cat is healthy, do the titers if you want to go that path. Have them sent to go to Protect the Pets, because you will pay a lot of money if it goes to Kansas State. So check out those resources. And then if you're in a state, and I think there's 28 states that have rabies waivers. So like in Colorado, if I see a patient and they're sick, like they have cancer, or they have some like kidney disease in cats, I can actually write a waiver saying that I don't recommend vaccinating this patient. They're not healthy enough for the vaccines. So have that conversation also with your veterinarian. I believe that information is also on the Protect the Pets website.
Wonderful.
I love that. Something that I love about this too, and I wanted to just kind of go over, I've seen a couple comments. I know we're not catching all the comments right now, but a couple comments about where they can find these questions to ask our veterinarians. Something that I love, and that link is in the description of this video. It's in the
description of this post, yes.
And you can download this awesome PDF. What I love that you're really kind of hammering home today is, and it's so empowering, is that there are so many resources out there for us pet parents, and that so many of these questions that we want to ask, and I'll ask you to give a little summary so people know kind of what's in this document, that there's just a little bit of homework that we have to do.
Mm-hmm.
And it's very empowering homework to do, but it helps us to go in with more information and even if we don't understand, I think that a lot of people feel that research is very overwhelming. They're not going to understand all the words. That's how I feel. Yeah. I feel better saying, if I'm going into the veterinarian, here's something that I read and it mentioned A, B, or C. Could you explain what that means? You know what I mean? It's part of having that conversation, but it does require us being more proactive and doing a little bit of homework on our own as well.
Yeah, but sometimes we're going to be put in those situations where even if we have gone through the checklist and we have done our due diligence and we've partnered with a good vet, it's a Sunday and there's an emergency that happens and we have to go to an ER vet, somebody that we've never seen, just whoever is open, because we got to get our cats to the vet then. And we haven't fostered a relationship with these people. We don't know who they are from Adam. And what are some like kind of just, I don't know if you say blanket responses, what's the word I'm looking for? Just like like when you get all those questions of, are they vaccinated? Do they, what are they fed? What, all of these things. If they disagree with the way that you are caring for your cat, what are some things that we can say that will still help the situation in when we're, not with a,
right. If we're
I can't
feeling,
use my words.
If you're in an emergency situation, how do you like diffuse it and also still be an advocate for your cat?
Yes.
So yes, of course. So, I think this is I see this all the time, right? You go in and they ask, are they up to date on vaccines? And you say no. And they go, well, we have to give them a rabies and things. And there's this whole other side where there's liability insurance too. And that's something that a lot of people don't realize. Like if that person, if a the staff, the client, someone gets bit and that pet is not vaccinated, they could actually lose liability insurance, which is not, you can't lose that. So that's why sometimes your veterinarian seems like they won't work with you. Now, this is a bigger problem with an ER situation. Your cat has to be seen. So I think in those stages, that's where I talk a lot and teach a lot about, okay, if your cat has to have this vaccine, like it is what it is. Like we need to make sure the cat is safe and healthy. Like say you have a blocked male cat, that's a true, you got to take, you can't wait until like 2 days when your vet is open again. Like they will die. You have to take care of that right away. And so this is where, okay, we have to give a vaccine. We have to give something we didn't want to give. Okay, well, what do we do now to support the immune system? So this is where, okay, hopefully you're already feeding an optimal food. You got that covered, right? So what other things can we use to support the immune system? How do we detox the body safely once we get them home? So, you know, I think there's a lot of fear around the V word, which, you know, I see a lot of animals that are damaged from being over vaccinated. So, and it happens. My husband, I think, was like his condition developed because he had 3 million V's in the military. It sounds so awful. He doesn't have like, it sounds like a sexually transmitted disease. So I'm sorry, Ryan. I don't know if I'll ever see this, but anyways, entertainment for your Sunday afternoon. So when we say V, we're referring to the thing, the jab. Okay. So it is a reality. That's the thing. But if you're in a situation where you do have to give it, that's where we go back to the principles of how do we detox our pets? How do we support their immune system? How do we support optimal gut health? So don't allow it to create so much fear that you refuse to get vet care, because I see that happening all the time. So I think that's the first thing I want to say. Like if you're in a situation and it has to happen, it is what it is. Like you can get most likely you can help your pet through that by implementing different things to help. And we have blog posts on how to detox your pet and supplements, like certain brands that I love and trust. So you can definitely go check those out at thenaturalpetdoctor.com. The other thing is that if they're asking like, what foods do you feed? You can say, I'm feeding a balanced if you're feeding raw food is like the one that sends people up the walls and like they think that they're automatically going to get salmonella poisoning from your cat, which isn't the case. But what you can say is, I'm working with my veterinarian. We've discussed the diet that my cat's on, and I'm feeding a balanced raw food diet that's hitting all the nutritional requirements, and my cat has been doing well with it. So that's what I would say versus just like a raw food, because here's the thing, as a veterinarian, and I've seen this and I see it all the time in social media, and I will actually go and I will assess and analyze some of these home cooked recipes or some of these raw recipes. And I'm like, these are so nutritionally deficient. And what's happening is that's what the vet automatically goes towards. We see so many nutritionally deficient diets that we know over the long term, it's going to cause a problem. And that's why they get their backs up. But if you're saying, I'm working with my normal veterinarian, they are aware of what I'm feeding, this diet is balanced, the company does regular testing, they're transparent, more than happy to share it with you if you'd like, or, you know, I've had this diet formulated to hit NRC requirements. You can throw out all these words, like that will help diffuse a vet that's not familiar with how raw food works or home cooked diets work. So I would definitely that's where being able to utilize some of those, you don't have to say it exactly like that. I know people will be able to rewatch this so you can listen to my words and just like write them down. But that's also, I think, very powerful. And it also takes away some of the like scariness for that veterinarian, like, oh my gosh, maybe this is related to the diet when it probably wasn't. What was the other question? So food, the V word. I think the hard part right now too is most like cat parents, dog parents, pet parents aren't being allowed into the clinic. So like we've added this whole nother level of stress where you can't necessarily be the advocate. And I see, unfortunately, a lot of times those pets come back out to you and they've been given V's, like, you know, and you're like, I didn't say that you could do that. And that's a scary thing. So I think having the conversation up front, just doing as much as you can to prepare yourself for a scenario where that could happen, and communicating as much as you can with that vet tech, that veterinarian, the receptionist, when you book that appointment. So for a non-emergency, saying like, hey, I want to be like, everything that you're going to give my pet, I need to approve ahead of time. Like, I just want to be in the loop so I can understand why you're giving this. So having that conversation ahead of time before they take your pet can also help you in these like this new area of vet medicine where you're not allowed into the clinic necessarily with your animal. So I think the more proactive we are with the information we have, the words we use, making sure that, not getting our backs up and reactive as much as we can. Emergencies are very hard. It's very stressful, and it's very financially stressful too, usually. So, but I think just having that conversation with the vet tech and the veterinarian and just being open and honest with them, what's really hard is when people don't say what they're giving. And then that way you don't know, like, if there was something that was given that might have caused that. So that's where supplements are very important, to talk to them. Like, don't be afraid. And I know that's easy to say because I see all the time, like with my own clients, like being, disregarded with what they're doing. However, it's so important that even if that veterinarian doesn't understand or know what it is, they can still research it and they can still look it up. And if that's playing a part for a symptom that you're seeing, it's very important also for any drug interactions. So the more transparent you are with what you're feeding, what you're giving, what you're using, if you're diffusing things like in the household, like essential oils, you use incense, there's so many factors that come into it. So I think being more transparent is definitely more helpful, even though it does create another level of stress.
Yeah, absolutely. Would you recommend, if somebody is, say they just got their first pet, they just got their first cat, or they just moved to a new area, would you recommend doing an interview with veterinarians before bringing, or maybe with your cat, or before bringing your cat in, and actually just like
calling them and just
calling them and getting some, maybe through some of these questions?
I think it's a great idea. Here's my warning for pet parents. Like, you're going to be charged for that time. So just FYI, like, because you are taking the place of a scheduled consultation. So that's something. And what you can ask for is, if you do a telehealth consultation where it's maybe 15 minutes, it'll be a lot cheaper than like a full consultation going into the vet clinic. Now, if that's what you want to do and you want to see how the veterinarian interacts with that puppy, then schedule just like a well checkup, like a new puppy visit. And it's not for, the V thing. It's not for, you just want to see how they interact. Just keep in mind, you are like, that is the doctor's time. So most likely most clinics are going to charge for that. But I think that's very important because you're hopefully partnering with this veterinarian for the next 15, 20 years of your dog and cat's life. And so if you're already getting started on the wrong foot, where they don't have the same values as you, they don't interact with your pet very well, they don't handle your pet, they don't have empathy, or you're just not connecting. Each person is different, and so you're going to connect with a veterinarian differently than I connect with a veterinarian. We're all individuals. And I love that. So I think it's very important if you can do that. Yes, 100%. So that way you feel comfortable with your vet and the care that you're going to hopefully be getting for the rest of your pet's life. And here's the thing too, like, they don't have to know everything, and they don't have to know how to formulate like a homemade diet. They don't have to know about raw food diets. Hopefully they're learning about that and opening their minds. They don't have to know how herbs work. They may not know how CBD works, but the thing is you want them to be open to it. So that way, if you decide you want to go down that path and add in someone like myself or another holistic or integrated practitioner that maybe doesn't do, like, I don't do the conventional side. I just focus solely on nutrition, herbs, acupuncture, because I love that part. And then I give all the other stuff like dentals and surgeries and things to my conventional practitioners. So ask them, are you open if I work with someone to figure out like a more holistic approach, and we'll still do all these things, but I want to make sure that you feel comfortable with that, and I'll keep you in the loop. And then that way we're doing all we can to keep my pet from getting sick. And I think that's really, really important. And if your vet says, nope, why don't you trust me? Then there's issues there. And that's where you go, red flag. Maybe I need to find another veterinarian. And at least you're in the start of the journey where your cat is still healthy. And it's not like your cat is sick, has to be seen, and now you're stuck with this person that's super close-minded to what you really want for them.
Right. Yeah.
I think it's so important too. I think, we've heard a lot this past year. It's been hard on pet parents. It's been hard on veterinarians as well. I mean, they are veterinarians because they love our companion animals so much. And I think that it's so incredible, especially this conversation right now, for us to feel more empowered and to recognize that there are tools that we can proactively implement in our own tool bags before we go in to interview a vet or into an appointment. I know emergencies happen, but they're a small percentage,
Yes.
ideally, of our pets' lives. So we focusing more on that proactive part of it, and recognizing that it takes all the conflict out. It diffuses everything. And if like you said, and I remember reading one of the articles you wrote about your journey towards integrative, holistic care, health, medicine, with your husband and being treated by a certain doctor. And instead of fighting back or whatever, you let it sit with you, and you realize you weren't going back there. It was just moving forward. And so it doesn't need to be a fight. It doesn't need to be the end of we're done with vets kind of thing. It's a very healthy path to go down for everyone. I do want to say, I know we're already running out of time, and you actually have a very busy Sunday, as you do every day of your life. Some of the other things in this, the link is in the description. Some of the other questions that you cover, as far as questions that we can ask our veterinarians, you cover behavior, you cover the V word, you cover nutrition. We had a heartbreaking message this morning from someone that was dealing with flea and tick prevention.
No.
And I think that that's something that is so empowering, that you do cover in this questionnaire, as well as dewormers. I think that those are two of the more potentially toxic things that our pets have to go through. And I love that you really break down risk versus treatments versus, all of that. Or if we do have to do, like you mentioned, detox, that sort of thing. Could you speak just for a second? I know we're running out of time.
Yeah. So
just a little.
Yes, definitely. So the flea and tick thing, these drugs that are newer drugs that have been around, I don't know if I should mention, like Credelio, Simparica, NexGard, Bravecto. They're all in this class of a neurotoxic drug. And what we're finding is that dogs and cats are developing neurological problems, behavior changes, seizures. I've had multiple cases of end-stage liver failure that couldn't be explained. And the only thing that had changed was the addition of something like this, like weeks prior.
Wow.
So this is where there's a time and a place. I always say that. And especially like heartworm preventatives, if you live in an area where there's lots of mosquitoes and the risk is super high, you don't want your dog or cat to get heartworm. So this is where you can utilize some of these medications at the right intervals and detox, right? But making sure we're also staying away from some of these drugs that we know have a higher risk to the pet and higher side effects. So with that, that's where talking to your veterinarian and asking, well, okay, I understand, like I'm supposed to give, like I hear all the time, I'm in Colorado, we get snow and it like freezes. And I'm like, I have clients that are like, well, my vet told me to give heartworm prevention all year round. I was like, the mosquitoes ain't here in the middle of winter. Like, you're fine. Like, give your pet a break. It's okay. And so think like that's the conversation you need to have with your veterinarian is, what is the risk? How many cases, what is the incidence of fleas, ticks, especially if you have a dog too, what like Lyme disease and these tick-borne diseases. So what is the risk to my pet? And so do I need to give this every single month if I have to give something? Also, are there other alternatives? And this is where doing your research, we have an entire blog post on natural remedies for flea and tick preventatives. So going there, check that out, because here's the thing. Those medications are insecticides, whereas when we use natural treatments, when we use food, those are going to be repellents. So they're gentle. You can combine, I usually say combine a lot of these natural treatments together for a stronger effect if you're in an area where there's lots of fleas and ticks, but you're less likely to get adverse side effects. And here's the thing, if you're trying the natural and you get a flea infestation, you can always use those other medications if you had to. Yes, a flea infestation is not fun to get rid of. I'm not saying it is, like it's a nightmare, getting rid of the life cycle in the house and things like that. But at least like you may never have to get to that point because you're doing the other things. So ask your veterinarian about that. Ask them about mosquitoes. Ask them, the dewormer thing always kills me because gut health, 80% of the immune system is in our pets' guts. It's in our guts. And if we're not protecting gut health, we're not protecting the immune system. And every time you give a flea and tick preventative, a heartworm preventative, a medication, non-steroidal steroids, drugs, your dewormers, you're taking out that microbiome, which is essential to the immune health of your pets. And so what you can do instead, and this is part of those questions, is, they say, oh, we'll just give this dewormer. Like, it's like part of the annual visit. Say, let's check a stool sample. Can we check a stool sample first and actually see if my pet has parasites? And then if they do, 100% yes, I will give this. But that's where we don't just need to give things. It's like, why are we giving this? What's my pet's risk? And how can, maybe there's another alternative that we can actually use first to support their overall health. So yeah, I get on my horse with that one, because I'm just like, why are we giving them so many drugs? Like, you don't need to. It's like crazy.
Especially kittens, right?
Oh,
I mean, it's just like, it's
they're
so
getting the vaccines, and then they're getting the like dewormers, and they're getting like all the things, and then they're getting like the revolution on top, and they're getting like, and then they're like transitioning, and like the stress is super high. You're probably changing the diet. And I'm like, no wonder why so many like cats, kittens get upper respiratory infections. Like they're super stressed.
Like it's amazing that, their bodies go through so much medically prior to 6 months of age in most cases, especially with shelter cats, which, we get because a lot of that just has to be done. Not all of it has to be done, but the spay, the neuter, certain things have to be done a little bit earlier than we would do if we were to just, find a kitten on the side of the road. But it, like, their immune systems are shot, and then you have to take a lot of time and due diligence to build that back as much.
Our recently adopted kitten, Moki, so he's a year old now. He was a hot mess when we got him. So like, we got him from the shelter. He has cerebellar hypoplasia. So he's already got like, some deficiencies, and his gut health. So he had 5 rounds of antibiotics before I got this kitten at 8 weeks. He had all of his V's. He was neutered. He had been moved from foster to foster. And like, he had massive amounts of diarrhea, of course. He had coccidia infections. He had upper respiratory infections. And of course, every time he's given drugs. So what we did, this cat has solid poop now, like very minimal because he's on a raw food diet, but we used supplements and supported his gut health and slowly transitioned him over. It took months, but you can do that. And when you look at, that's why I love those foundations and always going back to them. Like, and that's where we can integrate in, okay, maybe they do need the V thing, and maybe they do need a dewormer after we tested for it to make sure they truly need it. And that's where assessing. So one of the big things too, is the behavior side. And you ladies touched on it earlier, is that cats are so stoic. And a lot of times what happens is at the vet clinic, they're just talking about like the dewormer, the blood work, the V's, they're due for all of this. Let's just do that. But behavior is never mentioned. And behavior is such a big part of a cat's life, and also a big part if there's illness or other things going on, that if we don't address it and don't ask those questions. So as a cat parent, I love journals. Like when my clients have journals, I'm like, I love you so much. Like, cause you just made my life easier. I can see trends. I can see what's happening, but keep a journal or keep an eye on what's your cat doing? Are they not jumping up on things as much? Maybe they're not going up the stairs. Are they engaging with you as much? Or maybe they're isolating themselves. Are you noticing that they're like bringing up more fur balls? Are they vomiting their food? Are they getting more sensitive? Is their stool more like smelly? And keep track of all that, because when you go into the vet and they ask, how are they doing? You're like, they're fine. You could actually say, I'm noticing these things. Like, what could that be? Should we investigate it? What tests would we need to do to rule that out? So that way you can hopefully diagnose something or figure out, okay, maybe we need to do joint supplements. Like our cat's getting older, so let's add those in. Like, I feel like behavior is just missed. The life stages of cats like aren't talked about, how to change the food, what supplements. So that's where ask those questions like, hey, I've been looking at supplements. Like, I don't know where to go, but I'd love for you to tell me like what would help my cat so I can optimize their health. And I think those are very, very helpful. And it creates a whole different conversation when you go into the vet clinic, and then your cat's less stressed because you're not like all riled up and hot and sweaty like I get when I get like all fired up, and your vet's not. And it's just so much more pleasant, and everyone wins when that happens.
Yes.
I am
Yes,
so
I
sad to
agree.
say we've got 4 minutes left, but you've mentioned this a couple times, and I just want to hammer this home. You do have an incredible blog on your
Mhm.
website.
And Lindsay has dropped the link to Dr.
your website.
Katie's website. It's pinned here in the comments.
The
So you guys,
naturalpetdoctor.com.
yes, the naturalpetdoctor.com. So you guys can go there. Dr. Katie has offered a discount. If any of you guys are in that situation where you want to be able to partner, maybe you only have a conventional vet, but you would like to also be able to partner with someone more integrative or holistic, and you would like to talk to Dr. Katie, she has offered a discount code using, what is it? Cat lover.
Lovers.
Cat lover. You can use that discount code
Is
to
it
take.
lover or lovers?
It's lovers.
Lovers.
Sorry.
Lovers, add your S.
Plural, cat
Cat
lovers.
lovers.
And if there's an issue, of course, just send me a message and we'll make sure you get that. So don't
Yes.
worry.
Yes. And just so you know, Dr. Katie is going to be back with us each month to discuss more and more about your cats and cat health and all things surrounding cats and cat
I think
health.
we already picked our next topic, didn't we?
Yeah.
Yeah.
Yeah, I think
Yeah.
so. I think we're gonna be talking in, what is next month, September? We're gonna be talking in September about feline cancer. So I know many of you are dealing with situations right now. Many of us just want to avoid that altogether. I think the stats are what, 1 in 3 cats now are
Yeah.
diagnosed with cancer. So if we want to, we're gonna be discussing how to avoid it and how to help
Be
our kitties
proactive,
that are already diagnosed with the C word. So
All right, I know people are used to a Q&A. I'm so sorry we don't have time for that today, but in the last 2 minutes we have left, I know people are going to be crazy looking for you. Give a little list of everywhere that they can find you and some of the good stuff that you had there, because I know your resources are really impressive.
Yeah, so the naturalpetdoctor.com, that's our website. That's where the blog is at. There's also if you go to Facebook and Instagram, so the Natural Pet Doctor, on Instagram, if you click on the link, it actually goes to learn more. And there's a bunch of free resources that you can get into. We also have a YouTube channel. So Dr. Katie Woodley, the Natural Pet Doctor. We have our free Facebook community. So that's Natural Pet Parent Community. So that's where we do the weekly Q&As. Every Friday, 7 a.m. Mountain Standard Time, I do a live talk on different pet health topics. That's on our Facebook page and our Instagram, the Natural Pet Doctor. We also do a VIP Natural Pet Parent Club where I do live monthly webinars and also additional resources. And you can access, essentially, I think there's almost 2 years of webinars in there. There's a kidney disease for cats webinar that details different natural remedies and foods and things like that. We talked about what should you feed your pet. There's actually raw food diets and balanced diets and additional resources to help guide you how to use essential oils safely. I use a lot of essential oils, even with cats. So there's a lot of different topics that we cover in there. So if you want more, you can join in there. That's also, you can access that off of our website. It's in our Facebook community. It's on my Facebook page. It's on the Learn More. So if you have any questions or you're like, I feel like she mentioned something, I can't get it, just send me a message to info@thenaturalpetdoctor.com. The other thing we do have is also a cat holistic wellness guide. So that's like an ebook that details from kittens to seniors and covers foods, resources. I love giving people like the tips and tools with supplements, because most of the time you're like, give a probiotic, and you like go and you're like, there's 3 million probiotics. What do I do? And so there's a lot of the supplements I use for my own pets, but also, of course, for all my patients that I recommend that are good companies too. So there's a lot of good stuff in there that you can take advantage of. And that's on our natural care shop on our website. So if you go to the naturalpetdoctor.com, you'll find all of those things. They're there. So, but like I said, reach out if you need any help finding things, because there's a lot. So
Go down the
so
rabbit hole.
amazing.
I am so in love with you. You are such a gift to our entire community, to the entire world. You really
Yes.
are
Yes.
amazing. Thank you
you.
so much for your time
Thank
today.
you.
no, you guys are so great.
I
Thank you for
know.
having me. I'm so glad we found each other.
Oh my God,
too.
thank you again, Lindsay.
yeah. Thanks, Lindsay.
How did we live without you?
I don't know. How did I live without you, beautiful ladies? Like,
Some people-
seriously, like, so I'm coming to Reno at the beginning of October for the Holistic Vet Conference. So that's near you. It's near you, right?
Well, it's about
It's
8
a
hours.
quick plane.
Oh, it's 8 hours. Oh, never mind.
Well, no, but we were planning on going.
We were
We
thinking about
were
it.
thinking about going. We
This
might
may
still.
tip the scales.
Yeah. Now that we know
We'd
you're
love to
happy.
meet you.
We have to do a wine night. Yeah.
Oh yeah, totally. We
Ah.
definitely have that scheduled at some point. I'll fly out there and see you guys.
I can't wait.
Oh my goodness,
Thank
Dr.
you
Katie,
so much
thank
for
you so
today.
much.
Yeah, thank you, and
We'll
have
see
a
you
great
next
weekend.
month.
And thank you for everything you do for cat lovers. Like
Oh,
the impact you are making, I appreciate it. And you both are very inspiring. So thank you for everything you do.
Oh, that means
Likewise.
so much. Thank you. Thank you.
Before we
thank
cry,
you.
we're gonna close out.
Okay,
I love
bye
you so
everybody. We
much.
will see.
Thank
All right, bye.
Bye. We will be live at
VIP group.
3 p.m. in the VIP group for a
Yes.
Zoom, at 4:30 on YouTube for our podcast, and then 6 p.m. right back here on Facebook for our cat tip review. So we love you guys and hope to see you
Happy
a little bit
Sunday.
later.
Thank you again, Dr. Katie.
Thank you, Dr. Katie.
Bye, y'all.